Question 1. A behavior analyst is observing a child who often throws toys. She notices the child usually throws toys right after she asks him to clean up. The child's mom then immediately says, "Okay, fine, you don't have to clean up right now." What is the most likely function of the toy throwing behavior in this scenario? A. Automatic reinforcement, sensory. B. Attention. C. Access to tangibles. D. Escape. Answer: D. Escape. This question is asking about the function of a behavior, which means why the behavior is happening. The clue here is that the toy throwing happens right after a demand, clean up, and is followed by removal of that demand. You don't have to clean up. This sequence: a demand is presented, the behavior occurs, and the demand is removed, strongly suggests the behavior is being maintained because it helps the child escape the unwanted task. Automatic reinforcement is getting a feeling from the behavior itself, attention is getting noticed, and access to tangibles is getting a preferred item. None of those fit the pattern described as well as escaping the demand. Remember, the function tells you what the person gets out of doing the behavior. Question 2. You're tracking how often a student talks out in class. You use a counter and click it every time he talks out. Which type of measurement are you using? A. Duration. B. Latency. C. Frequency. D. Interval recording. Answer: C. Frequency. This question is about different ways to measure behavior. The keyword here is how often, and the action is click it every time. When you simply count how many times a behavior happens within a specific period, that's called frequency recording. Duration would be how long the behavior lasts. Latency is the time between a prompt and the start of the behavior, and interval recording involves checking if the behavior happened within specific time blocks. If you're just counting 1, 2, 3, every time it happens, you're measuring frequency. Just think of it like counting steps or jumping jacks. It's simply how many times something occurs. Question 3. A teacher wants to decrease a student's calling out without raising her hand. She decides that every time the student calls out, she will ignore him and call on another student who has their hand raised. What behavioral principle is the teacher primarily trying to apply to decrease the calling out? A. Positive punishment. B. Negative reinforcement. C. Extinction. D. Response cost. Answer: C. Extinction. This question asks about the principle used to decrease a behavior by ignoring it, specifically the calling out. The key is that the teacher is withholding the reinforcement that was likely maintaining the behavior, probably attention from the teacher. When a behavior that was previously reinforced is no longer followed by that reinforcement, its future likelihood of occurring decreases. This process is called extinction. Positive punishment would be adding something unpleasant. Negative reinforcement would be removing something unpleasant to increase a behavior, and response cost is taking away a reinforcer. By removing the attention that calling out probably got him before, the teacher is using extinction. Think of it as turning off the payoff for the behavior. Question 4. A behavior plan states you should deliver reinforcement on an average of every 5 minutes, as long as the target behavior hasn't occurred during that interval. This is an example of what schedule of reinforcement. A. Fixed interval, FI. B. Variable ratio, VR. C. Fixed ratio, FR. D. Variable interval, VI. Answer: D. Variable interval, VI. This question is testing your knowledge of basic reinforcement schedules. The schedule described involves reinforcement being available after a period of time, but the average time between reinforcements is 5 minutes, and the exact time varies. Interval means it's based on time, not the number of responses. Variable means the time changes, it's not fixed. Therefore, this is a variable interval, VI. Schedule, fixed interval, FI, would be exactly every 5 minutes. Variable ratio, VR, would be based on an average number of responses, and fixed ratio, FR, would be based on a fixed number of responses. When you hear average time, think variable interval. Question 5. When conducting a functional analysis, you are trying to A. Measure the frequency of a behavior in the natural environment. B. Systematically test the function of a behavior by arranging different conditions. C. Observe a behavior and its immediate antecedents and consequences. D. Determine a client's preferred items or activities. Answer B. Systematically test the function of a behavior by arranging different conditions. This question is about functional analysis, a specific type of functional assessment. The core idea of a functional analysis is not just observing, like taking ABC data or asking about preferences, but actively testing different possibilities for why a behavior is happening. This is done by setting up specific situations, like a condition where attention is given for the behavior, one where escape is allowed, etc., and seeing how the behavior changes in those different conditions. It's a controlled way to figure out the cause or function of the behavior. It's more than just watching. It's actively experimenting to see what makes the behavior happen. Question 6. A stimulus that signals that reinforcement is available for a specific behavior is called in A. S delta, SD. B. Conditioned stimulus, CS. C. Discriminative stimulus, SD. D. Unconditioned stimulus, US. Answer C. Discriminative stimulus, SD. This question is asking about a specific type of stimulus in ABA. A discriminative stimulus, SD, is like a green light. It tells you that if you perform a certain behavior right now, you will likely get reinforced. For example, the bell ringing for recess is an SD for going outside. If you go outside when the bell rings, you get to play. Reinforcement. And S delta, SD, is the opposite, signaling reinforcement is not available. Conditioned and unconditioned stimuli are terms used more in classical conditioning, not typically for signals for reinforcement in operant behavior. The SD is the signal that sets the occasion for a behavior because reinforcement has followed that behavior in the presence of that signal in the past. Question 7. Which of the following is the best example of negative reinforcement? A. Giving a child a sticker for cleaning their room. B. A person takes aspirin to relieve a headache and is more likely to take aspirin in the future when they have a headache. C. A student loses recess time for talking out in class. D. A parent yells at a child, causing the child to stop a behavior. Answer B. A person takes aspirin to relieve a headache and is more likely to take aspirin in the future when they have a headache. This question is tricky because people often confuse negative reinforcement with punishment. Negative reinforcement involves removing something unpleasant after a behavior, which makes that behavior more likely to happen in the future. In option B, the unpleasant headache is removed by taking aspirin, and this makes it more likely the person will take aspirin again when they have a headache. Option A is positive reinforcement, adding a sticker. Option C is response cost, taking away recess, a form of punishment. Option D could be positive punishment, adding yelling, or negative punishment, removing something pleasant for the child, though yelling is usually considered adding something unpleasant. The key is removal of something bad leading to an increase in the behavior. Think of it as escaping or avoiding something aversive. Question 8. A behavior analyst is teaching a child to wash their hands. She starts by reinforcing the child for just turning on the water, then for using soap, then for rinsing, and finally for drying. This process of reinforcing successive approximations of a target behavior is called A. Chaining, B. Shaping, C. Modeling, D. Prompting. Answer B. Shaping. This question describes the process of shaping. Shaping is used to teach new behaviors that the learner doesn't currently do. You start by reinforcing any behavior that is a little bit like the target behavior, an approximation, and then gradually only reinforce behaviors that are closer and closer to the final goal behavior. Chaining involves linking together behaviors that the learner already knows how to do. Modeling is demonstrating the behavior. Prompting is giving a hint or help to get the behavior started. When you're reinforcing steps that get closer to the final behavior, you're shaping. Think of shaping like sculpting clay. You gradually mold it into the final form. Question 9. You are collecting data on head hitting. You define head hitting as any instance where the client's open or closed hand makes contact with any part of the head above the neck. This is an example of a good. A. Reinforcement schedule. B. Measurement tool. C. Behavior definition. D. Functional hypothesis. Answer. C. Behavior definition. This question is about how we describe the behavior we are measuring. The sentence provided gives clear, specific details about what counts as head hitting and what doesn't below the neck. This makes it easy for anyone observing to agree on whether the behavior happened or not. This clear description is called an operational definition or behavior definition. It's crucial for accurate measurement. It's not a reinforcement schedule, which dictates when to reinforce, a measurement tool, like a stopwatch or counter, or a functional hypothesis, a guess about why the behavior happens. A good behavior definition is clear, objective, and complete, so anyone reading it knows exactly what behavior to look for. Question 10. A token economy is a system where individuals earn generalized conditioned reinforcers, like tokens or points, for specific behaviors, which they can later exchange for backup reinforcers, like toys or privileges. What behavioral principle is the foundation of a token economy? A. Punishment. B. Extinction. C. Reinforcement. D. Stimulus control. Answer. C. Reinforcement. This question asks about the core principle behind a token economy, while other principles might be used within a token economy, like response cost, a form of punishment, where tokens are lost. The fundamental reason people participate and behaviors increase in a token economy is because they are earning reinforcers, the tokens that can be exchanged for other reinforcers, the backup items. You are reinforcing desired behaviors with tokens, making those desired behaviors more likely in the future. Therefore, reinforcement is the foundation. It's all about motivating behavior by providing things the person wants. Question 11. When a behavior occurs more often in the presence of a specific stimulus than in its absence, we say that stimulus has acquired. A. Respondent control. B. Automatic reinforcement. C. Motivating operation. D. Stimulus control. Answer. D. Stimulus control. This question is about how cues in the environment can influence behavior. When a behavior consistently happens when a particular stimulus is present, but doesn't happen, or happens much less often when that stimulus is absent, the behavior is under stimulus control of that stimulus. Think of stopping at a red light, but driving through a green light. Your stopping behavior is under stimulus control of the traffic light color. Respondent control is related to reflex behaviors. Automatic reinforcement is getting reinforcement from the behavior itself, and a motivating operation changes the value of a reinforcer and the likelihood of behaviors that have gotten that reinforcer. Stimulus control is simply when a stimulus signals when a behavior is likely to pay off. Question 12. Sarah is teaching her client to imitate clapping hands. She says, "Clap hands," and immediately claps her hands. Her client then claps their hands. Sarah's clapping hand serves as a A. Reinforcer. B. Model. C. S delta SD. D. Negative punisher. Answer. B. Model. This question is about different roles stimuli can play in teaching. Sarah is demonstrating the behavior she wants the client to do right after she gives the instruction. When you show someone how to do a behavior so they can copy it, you are providing a model. The client's clapping might be reinforced, but Sarah's action of clapping is the model for imitation. And S delta signals reinforcement is unavailable. A negative punisher removes something to decrease behavior. Sarah's clap is specifically the example for the client to follow. Think of modeling like monkey see, monkey do. You show them what to do. Question 13. A BCBA wants to decrease a child's whining. The BCBA instructs the parents to ignore all instances of whining. After a few days of ignoring, the child's whining gets much louder and happens more often before it starts to decrease. This temporary increase in behavior at the start of an extinction procedure is called A. Spontaneous recovery, B. Behavioral contrast, C. Extinction burst, D. Punishment. Answer C. Extinction burst. This question describes a common effect seen when you first start ignoring a behavior that used to get a payoff. When you remove the reinforcement, like attention for whining, the behavior often gets worse before it gets better. It's like the person is trying harder to get the reinforcement back. This temporary increase in intensity or frequency is known as an extinction burst. Spontaneous recovery is when the behavior reappears later after it seemed to be extinguished. Behavioral contrast is when changing behavior in one setting affects it in another. Punishment is a procedure to decrease behavior by adding something unpleasant or removing something pleasant. The key here is the temporary increase when reinforcement is removed. That's the burst. Question 14. A student is being taught to follow instructions. The teacher gives the instruction, sit down, and gently guides the student to the chair. Physical prompt. Over time, the teacher gradually uses less and less physical guidance until the student sits down with just the verbal instruction. This process of gradually reducing prompts is called A. Shaping, B. Fading, C. Chaining, D. Generalization. Answer B. Fading. This question describes the process of fading. Fading is when you provide help, a prompt, to ensure the behavior happens, and then gradually reduce that help until the behavior occurs with just the natural cue, like the verbal instruction. You are essentially fading out the prompt. Shaping is reinforcing closer approximations of a behavior. Chaining links behaviors together. Generalization is when a behavior happens in new situations or with new stimuli. The key here is the gradual reduction of the prompt. Think of fading like turning down the volume on a helpful hint until the person can do it on their own. Question 15. You are working with a client who engages in self-injurious behavior, SIB. Your supervisor tells you to immediately block any instance of SIB and redirect the client's hands to squeeze a stress ball. Blocking the SIB is a form of A. Positive reinforcement, B. Negative punishment, C. Antecedent intervention, D. Response blocking. Answer D. Response blocking. This question is about a specific strategy used to prevent a behavior from occurring. When you physically stop a behavior from happening as soon as it starts, that's called response blocking. You are literally blocking the response. While it might serve a function, like preventing injury, the direct action of physically preventing the behavior from completing is called response blocking. Positive reinforcement adds something to increase behavior, negative punishment removes something to decrease behavior, and antecedent interventions happen before the behavior occurs to prevent it from happening in the first place, like removing triggers. Blocking is a specific consequence strategy that prevents the response. Question 16. Which type of graph is most commonly used in ABA to show how a behavior changes over time for an individual client? A. Bar graph, B. Scatter plot, C. Pie chart, D. Line graph. Specifically, cumulative records or standard acceleration charts are types of line graphs. Answer D. Line graph. Specifically, cumulative records or standard acceleration charts are types of line graphs. This question asks about the standard graph type in ABA to track progress over time for one person. While other graphs exist, the most common and fundamental type is the line graph. Line graphs are perfect for showing changes in behavior frequency, duration, etc., plotted against time, like sessions or days. This allows us to visually see trends, like if a behavior is increasing or decreasing. Cumulative records and standard acceleration charts are specific, powerful types of line graphs often used. Bar graphs compare different conditions or groups, scatter plots show relationships between two variables, and pie charts show parts of a whole. For tracking individual behavior change over time, the line graph is your go-to. Question 17. A therapist says, "Touch nose," and physically guides the client's hand to their nose. The physical guidance is an example of what type of prompt? A. Gestural prompt. B. Model prompt. C. Physical prompt. D. Verbal prompt. Answer: C. Physical prompt. This question asks about the type of prompt used. A prompt is a form of help given to encourage the correct behavior. When you physically touch or guide someone to perform a behavior, that is a physical prompt. A gestural prompt would be pointing or making a motion. A model prompt is showing them how to do it. A verbal prompt is telling them what to do. Since the therapist is using physical touch to guide the hand, it's a physical prompt. It's the most intrusive type of prompt, often used for teaching physical movements. Question 18. When a behavior occurs because it produces a specific sensory experience, like flapping hands because it feels good, the function is most likely A. Escape. B. Attention. C. Access to tangibles. D. Automatic reinforcement. Sensory. Answer: D. Automatic reinforcement. Sensory. This question is again asking about the function of a behavior, but specifically one that is maintained by internal sensations. When the behavior itself produces a reinforcing consequence that doesn't involve another person or getting an external item, it's considered automatic reinforcement. If that internal consequence is a sensory feeling or sensation, it's often called automatic sensory reinforcement. Escape involves getting away from something. Attention involves getting noticed by others, and access to tangibles involves getting a preferred item. Behaviors like hand flapping or humming that feel good to the person doing them, even if no one else is around, are often maintained by automatic sensory reinforcement. Question 19. You are tracking a student's on-task behavior during independent work time. You divide the 30-minute period into 10-second intervals and record if the student was on task for the entire 10 seconds. If they were on task for the whole interval, you mark it. If they weren't, even for 1 second, you don't mark it. What measurement method are you using? A. Momentary time sampling. B. Partial interval recording. C. Whole interval recording. D. Frequency. Answer: C. Whole interval recording. This question describes a specific type of interval recording. In whole interval recording, you mark the interval only if the behavior occurred continuously throughout the entire interval. This method often underestimates behaviors that happen frequently but briefly. Partial interval recording would mark if the behavior occurred at any point during the interval. Momentary time sampling records if the behavior is happening right at the end of the interval. Frequency is just counting occurrences. The key phrase here is for the entire 10 seconds. That specifies whole interval recording. Question 20. A client learns to say cookie to request a cookie. Later, they start saying cookie to request crackers, chips, and other snacks. This is an example of A. Discrimination. B. Generalization. C. Shaping. D. Prompting. Answer: B. Generalization. This question is about what happens when a learned behavior occurs in new situations or with new stimuli. The client learned to say cookie for a specific item, the cookie, but then started using that same word for other similar items, crackers, chips. This is an example of generalization, specifically stimulus generalization, where the response occurs to stimuli similar to the one it was originally taught with. Discrimination is learning to respond differently to different stimuli. Shaping is reinforcing approximations. Prompting is providing help. When a behavior spreads to new similar situations, it's generalization. Question 21. According to the BCBA Ethics Code, what should be your primary guiding principle when making decisions about a client's treatment? A. What is easiest for the staff or caregivers? B. What is the cheapest or most convenient option? C. The best interests of the client? D. What your supervisor tells you to do without question? Answer: C. The best interests of the client. This question is about ethics in ABA. While practical factors, like ease, cost, or supervisor instructions, are considered, the absolute most important ethical principle is always to act in the best interests of the client. Your decisions should prioritize their well-being, safety, and access to effective treatment based on data and ethical guidelines, even if it's not the easiest option. While you should follow supervisor instructions, those instructions should also be guided by the client's best interests, and you have an ethical responsibility to question instructions that seem unethical or not in the client's best interest. Always put the client first. Question 22. You are asked to record the time between when a teacher says, "Please sit down," and when the student actually begins to sit. What dimension of behavior are you measuring? A. Duration. B. Frequency. C. Inter-response time, IRT. D. Latency. Answer: D. Latency. This question asks about measuring the time between a stimulus, the teacher's instruction, and the start of a behavior, the student sitting. This time is called latency. Duration is how long the behavior lasts. Frequency is how many times it happens. Inter-response time, IRT, is the time between two consecutive instances of the same behavior. Since you're measuring the time it takes for the behavior to start after the cue, that's latency. Think of it as the lag time between the signal and the action. Question 23. Which of the following is not a primary method for conducting a functional behavior assessment, FBA? A. Indirect assessment, interviews, questionnaires. B. Direct observation, ABC data. C. Functional analysis, experimental manipulation. D. Preference assessment. Answer: D. Preference assessment. This question asks which method is not a primary way to figure out the function of a behavior as part of an FBA. Functional behavior assessment, FBA, is about understanding why a behavior is happening, its function. The main ways to do this are talking to people who know the person, indirect assessment, watching the person and recording what happens before, during, and after the behavior, direct observation / ABC data, and sometimes, in a controlled setting, setting up situations to test the possible functions, functional analysis. A preference assessment is used to find out what items or activities a person likes, which is helpful for choosing reinforcers, but it doesn't directly tell you why problem behavior is occurring. Question 24. A child screams every time their parent leaves the room. The screaming continues until the parent returns. The parent returning reinforces the screaming behavior. What type of reinforcement is most likely maintaining the screaming? A. Positive reinforcement, attention. B. Negative reinforcement, escape / avoidance of parent leaving. C. Positive punishment. D. Automatic reinforcement. Answer: A. Positive reinforcement, attention. This question describes a behavior, screaming, that is followed by something being added, the parent returning, which provides attention and access to the parent. This addition of the parent's presence / attention makes the screaming more likely to happen again when the parent tries to leave. Since something is added, positive, and the behavior increases, reinforcement, this is positive reinforcement. While it might feel like the child is trying to escape the parent leaving, the consequence that follows the behavior is the parent's return, which is best described as adding attention or access. Negative reinforcement would be if the screaming made something unpleasant go away to increase the behavior. Question 25. A supervisor tells you to use a DRA procedure for a client's hand flapping. You know that DRA stands for A. Differential reinforcement of alternative behavior. B. Differential reinforcement of absent behavior. C. Differential reinforcement of automatic behavior. D. Differential reinforcement of additional behavior. Answer: A. Differential reinforcement of alternative behavior. This question is about common ABA acronyms and procedures. DRA stands for differential reinforcement of alternative behavior. This procedure involves reinforcing a behavior that is an alternative to the unwanted behavior, while withholding reinforcement for the unwanted behavior. For example, reinforcing a child for squeezing a stress ball instead of flapping their hands. The other options are not standard ABA terms. When you see DRA, think reinforce something else instead. Question 26. You are teaching a child to follow the instruction, clap hands. You say clap hands and immediately clap the child's hands together. This is an example of using which type of prompt? A. Verbal prompt. B. Model prompt. C. Full physical prompt. D. Partial physical prompt. Answer: C. Full physical prompt. This question is similar to an earlier one, but asks for a more specific type of physical prompt. When you completely guide the learner's body to perform the behavior, like clapping your hands for them, this is a full physical prompt. A partial physical prompt would be just a slight touch or nudge. A verbal prompt is saying something, and a model prompt is showing them. Since you are doing the whole movement for the child by clapping their hands together, it's a full physical prompt. Question 27. A behavior technician is told to record data on a student's hitting behavior using a discontinuous measurement method. Which of the following is an example of a discontinuous measurement method? A. Frequency count. B. Duration recording. C. Momentary time sampling. D. Latency recording. Answer: C. Momentary time sampling. This question asks about different types of measurement and distinguishes between continuous and discontinuous methods. Continuous measurement methods, like frequency, duration, latency, and IRT, capture every instance of the behavior or its specific dimension. Discontinuous measurement methods, like interval recording and time sampling, only capture the behavior at certain points or within specific intervals, estimating the occurrence. Momentary time sampling is a type of discontinuous measurement because you are only checking for the behavior at the very end of each interval, not tracking it continuously. The others track every time or how long/how quickly it happens. Question 28. An event that occurs before a behavior is called an A. Consequence. B. Antecedent. C. Reinforcer. D. Response. Answer: B. Antecedent. This is a basic ABA definition question about the ABCs. Antecedent behavior consequence. The antecedent is what happens immediately before the behavior. The behavior, or response, is what the person does. The consequence is what happens immediately after the behavior. A reinforcer is a type of consequence that increases behavior. So, the event that sets the stage or occurs before the behavior is the antecedent. Think of it as the trigger or the situation in which the behavior happens. Question 29. A client's behavior plan includes a procedure where, for every 5 minutes, the client does not engage in hitting. They earn 1 token. If hitting occurs, the timer resets. This is an example of which differential reinforcement procedure? A. DRO. Differential reinforcement of other behavior. B. DRI. Differential reinforcement of incompatible behavior. C. DRA. Differential reinforcement of alternative behavior. D. DDRL. Differential reinforcement of low rates. Answer: A. DRO. Differential reinforcement of other behavior. This question describes a specific type of differential reinforcement. In DRO, differential reinforcement of other behavior, you reinforce the client for the absence of the target behavior during a specific interval. If the behavior does occur, they don't get the reinforcer for that interval, and often a timer resets. DRI reinforces a behavior that cannot happen at the same time as the target behavior, like sitting instead of running. D reinforces an alternative behavior, like asking for a break instead of screaming. DRL reinforces the behavior if it happens at a lower rate than before, but not necessarily zero. Since the client is reinforced for not hitting, it's DRO. Question 30. You are teaching a child to put on their shirt. You break the skill down into smaller steps. Arms in sleeves, put head through hole, pull shirt down. You teach the last step first. Pull shirt down. And when the child can do that, you teach the second to last step, put head through hole, and immediately prompt them to do the last step. You continue teaching the steps in reverse order until the child can do the whole sequence. This is an example of A. Forward chaining, B. Backward chaining, C. Total task presentation, D. Shaping. Answer: B. Backward chaining. This question describes a specific way of teaching a sequence of behaviors, a chain. In backward chaining, you teach the steps starting with the last step of the chain. Once the learner can do the last step independently, you teach the second to last step and have them complete the last step right after, and so on, moving backward through the steps until they can complete the entire chain from start to finish. Forward chaining teaches the first step first, then the second, etc. Total task presentation teaches all steps at once with prompting as needed. Shaping reinforces approximations. Since you are teaching the steps from the end to the beginning, it's backward chaining. This method is often good because the completion of the last step leads directly to the natural reinforcement, like the shirt being on. Question 31. A student consistently completes their math worksheet correctly when the teacher is sitting next to them, but rarely completes it when the teacher is across the room. This difference in performance based on the teacher's location suggests the teacher's proximity is acting as A. Motivating operation, MO. B. Conditioned reinforcer. C. Discriminative stimulus, SD. D. Punishment. Answer: C. Discriminative stimulus, SD. This question is about stimulus control. The teacher's presence nearby is a stimulus that signals that completing the worksheet is likely to be reinforced, perhaps by praise, help, or just avoiding negative consequences. When that stimulus, teacher nearby, is present, the behavior, completing the worksheet, happens. When the stimulus, teacher across the room, is different, the behavior doesn't happen. This means the behavior is under the stimulus control of the teacher's proximity. The teacher's presence is acting as a discriminative stimulus, SD, for completing the worksheet. A motivating operation changes the value of a reinforcer. Conditioned reinforcers are learned rewards. Punishment decreases behavior. The teacher's presence isn't a reward itself, but a signal that reinforcement is available for the behavior. Question 32. Which of the following procedures involves adding a stimulus after a behavior occurs to decrease the future probability of that behavior? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: C. Positive punishment. This question is asking about the definition of positive punishment. Positive means something is added, and punishment means the behavior decreases. So, positive punishment is when you add something unpleasant after a behavior, and this makes the behavior less likely to happen again. For example, if a child touches a hot stove, behavior, and feels pain, adding a stimulus, they are less likely to touch the stove again. Behavior decreases. Positive reinforcement adds something to increase behavior. Negative reinforcement removes something to increase behavior. Negative punishment removes something to decrease behavior. Remember, positive means add, negative means remove, and reinforcement increases behavior, punishment decreases behavior. Question 33. You are observing a child and marking a data sheet every 10 minutes if hitting occurred at any point during the preceding 10-minute interval. What type of measurement are you using? A. Whole interval recording. B. Momentary time sampling. C. Partial interval recording. D. Frequency. Answer: C. Partial interval recording. This question describes another type of interval recording. In partial interval recording, you mark the interval if the behavior occurred for any part of the interval, even just for a second. This method often overestimates the duration or frequency of the behavior. Whole interval recording requires the behavior to occur throughout the entire interval. Momentary time sampling checks only at the end of the interval. Frequency is just counting occurrences. The key phrase here is at any point during a preceding 10-minute interval. That specifies partial interval recording. Question 34. An establishing operation, EO, is a type of motivating operation, MO, that A. Makes a reinforcer more valuable and the behavior to get it more likely. B. Makes a punisher less aversive and the behavior to avoid it less likely. C. Signals that reinforcement is available. D. Occurs immediately after a behavior. Answer. A. Makes a reinforcer more valuable and the behavior to get it more likely. This question is about motivating operations, MOs, specifically the type called an establishing operation, EO. An EO is something that changes how much you want a particular reinforcer, makes it more valuable, and makes you more likely to do behaviors that have gotten you that reinforcer in the past. For example, being very thirsty, EO, makes water, reinforcer, more valuable and makes you more likely to get a drink. The opposite is an abolishing operation, AO, which makes a reinforcer less valuable. Option B is incorrect as EOs typically affect reinforcers positively, increase value, or punishers negatively, increase aversiveness. Option C describes a discriminative stimulus, SD. Option D describes a consequence. EOs are crucial because they explain why the same reinforcer works sometimes but not others. It depends on whether the EO is present or not. Question 35. Which experimental design is typically used to show a clear cause and effect relationship between an intervention and a behavior by repeatedly adding and removing the intervention? A. Multiple baseline design. B. Reversal design, a BA or ABAB. C. Changing criterion design. D. AB design. Answer. B. Reversal design, a BA or ABAB. This question asks about experimental designs used in ABA to show that the intervention caused the change in behavior. A reversal design, like ABA or ABAB, is a strong way to show this because you collect baseline data, A. Introduce the intervention, B. Then remove the intervention, return to A, to see if the behavior goes back to baseline levels, and sometimes reintroduce the intervention. B. If the behavior reliably changes only when the intervention is present, it strongly suggests the intervention is effective. A multiple baseline design shows the effect across different behaviors, settings, or individuals without removing the intervention. A changing criterion design gradually changes the requirement for reinforcement. An AB design is simply baseline followed by intervention and doesn't rule out other factors causing the change. The key here is the reversal back to baseline conditions.